In this case, in the upper face, it's all once again led by consultation, understanding what the patient is concerned by and then educating them on what is the underlying cause of that. So she had frown lines that had become resistant to toxin, and so she actually needed volume underneath her labella, something she'd had many years previously with a different technique when I directly treated her frown lines. She also self-presented saying she needed temple volume replacement, but also when you look closely after correcting her temples, you often see that the lateral frontal fat pad is also depleted. If you want to get a smooth, continuous shape along the forehead, you often need to treat lateral frontal fat pad and temples together, and then sometimes even the line that divides the two of them. If there's a shadow running along the temple crest, you fill underneath and above that to make it one continuous smooth line. So in this video, you will learn how to treat a risky area in what I believe to be a safe way. We use a lot of cannulas, patience, and some techniques while using the cannula that validate that it's not in a vessel. I've been looking, before I started treating the temple, for any risks that I can avoid. So with the ultrasound scanner, I couldn't see an artery here, but I always use a finger as well, because I think, you know, it's just layering up. Sometimes your probe can be angled in the wrong direction, or potentially you can squash a small vessel so you can't see it on the ultrasound, and then you can feel it more with your finger. So I always do both. So I've now done that. I can see this transition where the shadow forms, which is my aesthetic goal, and I'm now choosing my entry point to do the restoration of volume. I like to angle in such a way as I cannot, if I go too deep, go into an area that I wouldn't want to. So worst case scenario, this is nowhere near where I'd inject, but if I was to inject back here, this is just over the terion of the suture point. So remember, there are these bones in your skull, they all meet at a particular point, and the terion is a weak point, and it's quite thin. Obviously it gets thinner as you get older, and you could in theory put a needle straight through that, and then you'd be introducing filler into the cranium. So I always inject in a way that would be impossible, because I'm now angled up towards the frontalis. So my angle of entry is actually continuous. If I was to go deep, I'd be going into the frontal bone. I'm not going to do that anyway, because I only need to kiss the bone and stop, but it just gives me another layer of safety. I've checked for vessels, can't see any here, so I'm now ready. Cleaned the skin multiple times. So now we will enter in, touch the bone, which isn't as deep as you may think, and then we'll do a nice long aspiration. Now, movement after you aspirate is fine because I have a negative pressure. It actually increases sensitivity to intravascular placement. Close off really slowly. Now, nothing wrong if you're on lower risk to move the needle again slightly, a millimeter here or there. Aspirate again, and just keep reducing the risk of a large vascular occlusion. Because I touched the bone, the needle's a little bit blunt now, even though I've only touched it once. So I can hear that noise. I'm not going to come in and out again. Massage. So this is looking good. That's leveled it. We haven't got an outward curve, which is not what I want. I want a flat area, but I can now see the opportunity above to improve the lateral frontal fat pad. And this is often the way in this area. You correct one area and you see the transition more clearly elsewhere. So we'll do that once we've done the other side of the temple. So I have a new needle now. I will feel again, just in case there are any vessels. Aspirate. Give it some time. Slowly start to inject. Little massage. Right, so now we're just going to do a tiny bit of airbrushing here just to try and change the contour to be a slightly more harmonious shift. It's not exactly a distraction at all, this is super subtle, but if we're going to make someone look fresher and younger, hiding the transition points between temple, lateral forehead and frontal eminence is one way to do it. This is a lot what makeup actually does for people. So I'm going to once again feel for any blood vessels. This is a deep injection if you can get to the periosteum. I'll be using a cannula. Bevel will be facing downwards. And the trickiest bit is just finding your layer. Once you're in, it's usually pretty straightforward. This is an interesting place to treat. Just here where the corrugator inserts, you often get a little shadow caused by frowning that doesn't go away after toxin. And this can be a nice way to make someone look more relaxed. Very little product. So we'll see if we can edge our way into there. Very much relying on ease of movement. If you want to add an extra layer, you can compress where the vessels might be. If you just look at the reflection on the skin here, there's more complexity on this side that's not treated than on this side, which just looks a bit more matte. It's not actually more matte, it's just spreading out the light in a more consistent way so that you don't see clusters of it. So it already looks better, but just like makeup more than anything else, it's quite interesting how different that looks in a very subtle way. So we should now get the same result here just by adding volume into this section. So the next area, I just want to add a little bit of volume here, is the labella. So this requires a slightly different entry point because I simply cannot reach across all of it. So I'm going to go in lateral to the labella. Now I'm often thinking about supraorbital here. I want to miss supraorbital. Go underneath them, hopefully. But one of my defenses here is simply being gentle and patient. So I call these the analog variables because it's impossible to measure how much patience and makes you safer, but it seems obvious to me that it would, but we'll never have a randomized control trial. Moving freely, aspirate, compress any vessels, inject while moving. I'm also at 90 degrees to any vessels, which makes it far less likely that you'll be in them. So I'm just seeing a little shadow here that I can't ignore before I move on to the rest of the face. I want to just improve this little indentation here. It's part of the temple. It's where we're injected, we just need a bit more